Good day, everyone. Today, we're going to start with our course in biostatistics. Kotona kap, aja kap. Tamay raw tong rin siwa sa titi. Raw Japan mo, may siyak sa titi sa noya. Samay kap, samay. As some of you are in the early stage of being a medical student or maybe a pre-medical student, you might have asked, why is it necessary to study biostatistics? But as you proceed with doing your own research or as you read medical literature, you will need better understanding of biostatistics. As you know, every research primarily has its objectives. And before gathering data which eventually be analyzed, one must know what data are to be collected. And before knowing what data are to be collected, a suitable research design must be agreed upon. And the research design must ensure that objective will be answered by the end of the study.
Biostatistics is critical to medical research. Biostatisticians actually design the studies that help to provide evidence that therapeutic interventions might work. They figure out how many patients do you need, what's the expected result for these patients, and they do all of the design stage, and then they do all of the analyses. So biostatistics is very critical to medical research.
So the first thing we might want to look at is what do we do here?
Of all of the mathematical disciplines, biostat's the least math nerdy because it's the most connected to science and the real world.
One example of this, so at the top it says example, diabetes control and complications trial.
We partner hand in hand with scientists who are generating fascinating data every day.
You have all the epidemiologists, mental health scientists, so that you can help them to actually solve those problems.
From when I was collaborating in a study of the effects of boxing on neurological outcomes. Everything from cardiology in prenatal infants to how do we prevent frailty in older adults and everything in between.
In this video, we will categorize the research designs into 5 categories: the basic studies, observational, experimental, systematic review, and economic evaluation. Let's begin with basic studies, which are either an animal experiment, a method development research, or a study involving medical genetics. An animal experiment is the scientific study of animals, usually in laboratory, for the purpose of gaining new biological knowledge or solving specific medical, veterinary medical, dental, or biological problems. It is known that animals are biologically very similar to humans. In fact, mice, for example, share more than 98% DNA with humans. Animals are known to be susceptible to many of the same conditions and diseases as humans, like cancer, diabetes, and heart diseases, which are also present in animals. Basically, animal experiments are there to prevent human tragedy, as human patients cannot take substances, of course, without being tested with animals first. Aside from that, animal models can be studied throughout the whole animal lifespan and across several generations, since the lifespan of animals are shorter than humans. One example of an animal study is done by Tefera and others in 2020, wherein they found out that Lens culinaris medic seeds, which are commonly known as the legume seeds, have anti-diabetic property. Their results show that after 3 hours, the blood glucose level of mice significantly decreased after being treated with 400 milligrams per kilograms of these seeds. Method development research, on the other hand, seeks for the development or improvement of biochemical, imaging, or biometric methods. A study that establishes the identity, purity, physical characteristics, and potency of drugs, including its bioavailability and stability, is a method development research. Like for example, in this figure contributed by Dr. Backlin and Dr. Sorman, we can see the plasma concentrations represented by the y-axis and the time following drug administration represented by the x-axis. We can see here how much fraction of the drug's initial dose successfully reaches the intended target. A study that develops a new method of measurement and check if it is as accurate as the one established in clinical use is also a method development research. Like in this example by Dr. Alzarani and others, wherein they compared the commercially available glucometer with the one they're being used in the clinic, which is the Architect C8000 analyzer. Although the results show that the commercially available glucometer does not differ with the Architect C8000 analyzer, the commercially available glucometer had slight differences when the blood glucose are high. A research that develops mathematical and statistical methods, including their applications in various fields like biological sciences, clinical and public health researches, is also a method development research. Like in this research by Dr. Zafra, wherein he proposed artificial neural network models to predict incidence of dengue cases in various regions in the Philippines. Results show that all the models have logarithmic errors which are less than 0.04. The study of genes and their role in inheritance, or in other words, the way that certain traits or conditions are passed down from one generation to another, is another form of basic study. As we know, genetics are scientific studies of genes and their effects, as genes carry the instructions of making proteins which directs the activity of cells and functions of the body. Example of genetic or inherited disorders include cystic fibrosis, Huntington's disease, and phenylketonuria. An example of a medical genetics study is published in this 2020 Swiss study, where it was found from 14 patients with bilateral childhood glaucoma, 6 have pathogenic variants of CYP1B1, and 1 has frameshift FOXC1 variant. Moving on, let's have observational studies. It is called observational because the investigator observes individuals without manipulation or intervention. In other words, these studies are non-experimental or non-interventional, in which we're going to talk about experimental studies in a while. Meanwhile, observational studies may be divided into two: descriptive observational and analytical observational studies. Descriptive observational studies are either case study, case series, or cross-sectional studies. Let's start with case study, also known as the case reports. These are the detailed reports of the symptoms, signs, diagnosis, treatment, and follow-up of an individual patient. Case study usually describe an unusual or novel occurrence and as such remain one of the cornerstone in medical progress and provides new ideas in the field of medicine. Usually, a case study is a rapid short communication between busy clinicians who may not have time or resources to conduct large-scale research. One example of a case study is done by Mr. Alnafi, wherein he presented a patient who had COVID-19, in which 5 months after being infected by SARS-CoV-2, although having no symptoms, still the patient has hypokalemia and hypomagnesemia. It is important to note, however, that a case study is not conclusive, and it is just there to improve understanding of the situation. Thus, it doesn't follow that patients with COVID-19 will have the same situation as having hypokalemia or hypomagnesemia as presented by Mr. Alnafi. Case series, on the other hand, is about a collection of patients having common characteristics. Similar with case study, it is used to describe some clinical, pathophysiological, or operational aspects of a disease, treatment, or diagnostic procedures, and are used to describe the potential effectiveness of new interventions, for describing the effectiveness of interventions on unusual diagnosis, and for describing unusual responses, either good or bad, to interventions. It is important to note that in case series studies, researchers do not manipulate the intervention, but just merely describes what happened during the normal course of intervention. An example of case series is done in 2021 in China, where the researchers presented 20 pregnant women with COVID-19. Their results show that although there were 4 women who had preterm birth, no neonatal SARS-CoV-2 infection was detected. With regards to the number of patients, it is suggested by Dr. Abu Zidan and others in 2012 that a case series should have more than 4 patients, while 4 patients or less should be reported individually as a case study. Another observational study is cross-sectional, which describes what is happening at the present moment. This may be descriptive or analytical. It is descriptive if it simply presents the prevalence of a disease, epidemiology, survey of a disease, or a clinical outcome. On the other hand, it is analytical if it compares groups of individuals that may explain potential causal associations between causes, which are called exposures, and outcomes, which may be a disease or a clinical outcome. Example of a cross-sectional study is done in Germany, where it was found that the prevalence of obesity among 5 and 6-year-old children who were never breastfed is 4.5%, as compared with 2.8% of those who were breastfed. So the researchers recommended breastfeeding in industrialized countries to reduce obesity in children. Aside from being faster and are inexpensive, cross-sectional studies are conducted before planning a cohort study or a baseline in a cohort study. Of what cohort studies are analytical. And unlike cross-sectional studies which presents what is happening, cohort studies, or also known as the follow-up studies, are generally prospective and inquire what will happen in the future. In this study, a group of people are selected according to some defining characteristics, and that they have certain disease risk factors or health outcome. For example, group of individuals having hypertension or type 2 diabetes. Commonly, they are called as the exposed group. They will then be compared to healthy individuals called as the non-exposed group to investigate the effects of these factors on a clinical outcome or a disease after a follow-up period. Like for example, in 10 years, will they develop cancer or not? An example of a cohort study is done in Finland, which was published in 2018, where the researchers found that the risk of developing pancreatic cancer after 10 years of follow-up is twice on patients who have periodontitis as compared to patients who do not have. Because prospective cohort studies may require long follow-up periods, it is important to minimize loss to follow-up. Loss to follow-up is a situation wherein the investigator loses contact with the subject, resulting to missing data. And if too many subjects are lost to follow-up, the internal validity of the study is reduced. And it is said that loss to follow-up rate shall not exceed 20% of the sample. Now, if cross-sectional studies is about the present, cohort is about the future, case control studies are about the past. Case control studies are often used to identify factors that may contribute to a health condition by comparing subjects who actually have that condition or disease, called as the cases, and individuals who do not actually have that disease or condition but are similar, which are called as the controls. To illustrate, we have two groups, the cases and control. Then, retrospectively, specific attributes called as the exposure status are to be assessed if it is a factor of why the disease developed. For example, patients with lung cancer and without lung cancer will be compared, and their exposure to cigarette smoking will be asked, did you smoke or did you not? To show an example of a case control study, we have this study published in 2020, which is about the Zika virus infection, wherein results show that the odds that typical Zika virus infection were present is 17 times to patients with Guillain-Barré syndrome as compared to patients without the Guillain-Barré syndrome. In medicine, experimental, also known as the interventional studies, compare the effect of the treatment or the intervention with the control in humans. Placebo or different treatments or interventions may be used as control. This study may be conducted into 4 phases. Phase 1, which involves a small number of individuals, usually 20 to 80, to determine whether a drug or a treatment is safe. Phase 2 study is done in a target population, usually 75 to 300, to determine the effect of the drug or a treatment. Standard treatment has to be compared with placebo in Phase 2 clinical trials. Phase 3 is conducted on many patients, like 1,000 to 2,000 patients, to determine whether the new drug is better than the standard drug. It is done to reveal that a drug is not only safe and effective, but also has better and less adverse effects than the standard treatment. Phase 4 clinical trials are post-marketing surveillance studies. The new drug has been approved by the ministry in this phase. To start off, we have the randomized controlled trial, wherein patients are assigned at random to either the experimental or the control group. In this study, patients are blinded to which group they belong.
Certain cancer treatment trials test whether new treatment works better or worse than the usual treatment. If you join such a trial, a computer may be used to randomly assign you to either the usual treatment group or the new treatment group. This is called randomization. While at first it may seem unfair that you can't choose which treatment you'll receive, there is an important reason why. Randomization helps ensure that the trial's results will be trustworthy. That's because randomization helps prevent false results due to bias. Bias occurs when the trial's results are affected by factors not related to the treatment being tested. For example, without realizing it, a doctor may assign healthier patients to the new treatment group and sicker patients to the usual treatment group. This could make the new treatment seem more effective or safer than it really is.
It is said that randomized controlled trials produces the strongest evidence among clinical trials since patients are assigned at random. Thus, this design is the only test of cause and effect relationship since randomization washes out any possible bias. One example of RCT is published in 2020 by a group of researchers in Norway wherein they try to investigate if among pregnant women, increased intake of Atlantic cod, a fish species with relatively lower methyl mercury contamination, influences total hair mercury concentrations in humans. Results show that the total hair mercury concentrations were generally low in both groups of pregnant women despite having relatively high seafood intake. While the intervention of 400 grams of Atlantic cod fillets per week during the course of 16 weeks slightly increased the total hair mercury concentrations, it did not lead to an increase in number of subjects exceeding the dose level at which adverse effects are expected to occur over a period of lifetime exposure. Next, we have non-randomized controlled trial in which participants are not assigned randomly to different treatment groups. Participants may choose the group where they want to be in or they may be assigned to groups by the researchers. In most cases, non-randomized controlled trial are done because the consent for randomization is difficult to achieve since patients have already chosen the treatment they want to receive. Another reason for that, surgeons, for example, are more skilled to one surgical procedure over the other. One example of non-randomized controlled trial is this study where older adults participated in an exercise program using a Nintendo Wii Fit Plus or a bicycle ergometer and treadmill. These interventions were performed 30 minutes twice a week in 8 weeks. And results show that although the video-based program was more effective than the physical activity, both methods improved the mood and mobility of older adults. In self-control studies, patients are at their own controls. At least 2 measurements are obtained at different times from same patients and the effect of the intervention or the treatment is determined. Like for example, in a research published in 2010 from a total of 47 tramadol-intoxicated participants who completed the study, 91% of them had post-seizure symptoms resolution after taking naloxone. In crossover studies, patients are assigned to 2 groups, the placebo and the treatment group. After a time, the research is interrupted for a so-called washout period. This will take for at least 2 weeks and patients receive no treatment during this period. At the end of the washout period, the experimental group receives the placebo and the placebo group receives the experimental treatment. And then the effect of the experimental treatment is determined by the comparison of the 2 groups. An example of a crossover study was published in 2020 where the effect of ustekinumab on aortic vascular inflammation is measured. A total of 43 patients were randomized and at the end of week 12, the placebo patients were crossover and received the ustekinumab treatment, and the ustekinumab-treated patients received the placebo. Their results showed that inflammatory markers were reduced and there were increases in selected measures of lipids and leptin. Aside from the basic studies, observational studies, and experimental studies, one common medical research category is the systematic review, which is a review that reports research questions, sources that were searched through database, inclusion and exclusion criteria, selection or the screening methods, the risk of bias of the included studies, information about data analysis and synthesis that allows the reproducibility of the results. Basically, systematic review provides an up-to-date summary of an intervention, diagnostic test, prognostic factor, or other health or healthcare topic. And when the selected studies have numerical results, meta-analysis may take place, which is the statistical analysis of a large collection of analysis results from individual studies for the purpose of integrating the findings. An example of this is done by Dr. Raman, in which we can see the incidence of strokes in various published research articles. And by meta-analysis, it shows that the incidence of stroke is 2.6%. Consider that in medical research, economic evaluation exists, and these are the studies that compare the cost and outcome of healthcare interventions. And these include cost analysis that estimates the total cost of a particular disease or health condition on society. Cost minimization, which compares two alternative drugs' costs and outcomes to determine the least costly drug. Cost utility analysis, which compares two alternative drugs' costs and outcomes to determine the most useful drug. Cost-effective analysis, which compares two alternative drugs' costs and clinical outcomes to determine the most effective drug. This is the most widely used economic evaluation method. Cost-benefit analysis, in which costs and benefits are expressed in terms of monetary units. This is rarely used in economic evaluations. I hope you learned the overview of the study designs in medical research through this video. You may click like, you may also subscribe, and you may comment down below for feedback and suggestions. Thank you for watching and stay safe, guys!